Welcome once again. So we start session 3, and as I mentioned earlier also, we'll be covering a part of previous session where we talked about different communication competencies, including verbal and non-verbal communication. So to sum up all that, I would say if we can keep a couple of these skills, handy, you will see you will be able to really work very well with your patients and their family members and also with your fellow professionals. Although there are a lot of skills, but I found that these 5 skills can really help us do very well with the in our professional setup. So one of these skills that I would recommend one and all is building rapport. What exactly we mean by building rapport? If somebody would like to unmute and speak, what exactly we mean by building rapport? Okay, Dr. Seuss is breaking. Yes.
Problem.
Okay. Satyapal, you rose your hand. You want to say something?
जी मैम, जैसे हम रिलेशनशिप पे कोई पेशेंट आता है और उनके साथ हम एक रिलेशन बिल्ड करते हैं, तो आई थिंक रिलेशन बिल्ड ही आप करना है.
ओके
मैम, आई एम ऑडिबल?
या एक्चुअली मुझे लग रहा है आपके यहाँ नेटवर्क इशू है, या तो आपको अपनी वीडियो ऑफ करके बोलना पड़ेगा तो ऑडियो की क्वालिटी इंप्रूव हो जाएगी. इफ यू कैन स्विच ऑफ योर वीडियो एंड स्पीक. आपका वीडियो भी हैंग हो गया है. Dr. Mehul, you were saying something?
Yeah. Madam, in context to, when we're talking context to a patient and healthcare situation, important to build a rapport. First, the importance of doing that is you will find a common ground at which you are able to communicate easily. And if you've built a rapport, you've been able to, I would say that you've been able to conquer at least 60% or 70% of the problems, where your messages are can be put forward in a very simple way. So building a rapport probably involves in trying to get the person on your own side, to make him on the same page, for which you need to win his confidence.
Okay.
Win his trust.
Excellent. I think you are covering almost everything. So I would request everyone to cover one point so that everybody gets a chance to speak. Thank you. Yes, Jayapriya, I think you wish to add something to what Dr. Mehul said.
I mean, where he says what happens when you build rapport. So I was trying to define what is building rapport. So making the first connection and then creating a relationship, and like what Dr. Mehul said, building trust, and then going forward. This is especially true when it comes to interpersonal in the healthcare setting, not necessarily patient, other doctors, other healthcare personnel, other consultants,
absolutely,
everybody else who's involved. Yeah, so that makes things easy for us.
Yeah. Like Dr. Siyog has also written, it's like breaking ice and then also knowing and understanding. Again, I think I give a very simple definition that it's like, creating comfort and familiarity with the person. It could be patient, it could be their family member, it could be your fellow professional, because we have to work with them. So we need to become comfortable. We need to become familiar with each other, and we feel like interacting. So we are breaking the ice, like Dr. Seo has mentioned just now. So exactly that is building rapport. But now my next question, and I want somebody else to answer other than Dr. Japriya and Dr. Mehul. Why to build rapport? Lavanya, what do you say? Neha, Mariam, what do you say? Why to build rapport?
So, ma'am, I feel, and even I've experienced it, once we have a rapport with our counterpart, they agree to what we are trying to communicate. Instead of as in, definitely there's scope of discussion also, because it's a two-way process, but at least that person is ready to listen to you. And
absolutely,
maybe
I think that's very important. Yeah. And also not just listen, a lot of time they need to talk about their problem. For example, if it is a patient, they're going to share their personal information with you. So they need to have that confidence that if I can really share my personal information with the person whom I'm meeting for the first time. So that also is a very important beginning of the interaction. Yeah.
Yes.
Neha, what do you say? Why to build rapport? Unmute your device, Neha.
The same thing that you said.
Yeah.
The person, you develop trust in the person, and the person volunteers to give you information that you would have otherwise had to probe in. So it comes about easily from the other person.
Absolutely. Now, my next question is, does it take time? And if it
No,
takes time,
not
I want everybody to write in the chat box, how much time do you think it takes to build rapport? Write in the chat box. Okay, Dr. Mehul says seconds. Okay, let's see what others say. Mariam says first 1 minute. Wow, okay. How about others? 3 to 4 minutes. Okay. You know, often I get to hear from my audience, especially if they are in a government setup, they would say, where is the time to build rapport? We don't have time to build rapport. So therefore, we work very mechanically. And my answer to them is, rapport building does not require time. It's more a matter of your mindset than time. Because whether you want to build rapport or not, that's your choice. And if you want to make it, it doesn't take any time at all. So we'll do a small activity to see how that 1 minute, like some of you have mentioned, or a couple of seconds that you have mentioned, how that can be enough to build a rapport. I'm going to put all of you in breakout rooms. It's a new pedagogy. So as I said, every time you will learn something new because you have to become comfortable with these things. So I'm going to put you in pairs. I'll put you all in breakout rooms in pairs. And I want you to be in the breakout room for 3 minutes. In the 3 minutes, each one of you will speak turn by turn. First, one person will speak, the other person will listen. Then in the second minute, the second person will speak and the first one who was speaking earlier would listen. And then the last 1 minute is given. In case if there is something more to be added or talked, you can take that another minute. I'm giving you that 1 minute extra so that you can complete your discussion. And the prompt of the discussion is the purpose of joining this program. Why did you choose this program? So after all, you are going to spend your 10 evenings with all of us. You have paid for the program. So it's a huge investment in terms of your time, money, energy, and that too after a day long of working, you choose to be here. So there must be definitely a purpose. So with your partner, in 1 minute, tell the reason for your joining this program, the purpose of joining this program. So I'm not going to, handpick anybody to be partner with each other. I'm just going to, at random, make you partner with anybody who is part of the program. सत्यपाल, अनस, आपको मेरी बात समझ आई?
जी मैम.
अनस, आप कहाँ पर हैं? अनस, आपको मेरी आवाज सुनाई दे रही है? सत्यपाल, आपको मेरी आवाज सुनाई दे रही है?
जी मैम, मुझे आपकी आवाज क्लियर आ रही है.
ओके, मैं आप सब लोगों को एक ब्रेकआउट रूम में डालने वाली हूँ एक पार्टनर के साथ में, और आपको 1 मिनट में बताना है एक दूसरे को कि आपने ये प्रोग्राम क्यों ज्वाइन करा, क्या रीजन है, क्या पर्पस है आपका ज्वाइनिंग का. एक बारी आप बोलेंगे, फिर दूसरी बारी में आपका पार्टनर बोलेगा और आप सुनेंगे, और फिर उसके बाद हम मेन रूम में जब आकर मिलेंगे तो बात करेंगे. सो आई एम पुटिंग यू ऑल इन द ब्रेकआउट रूम. I think Seema ji has joined, if I'm not wrong. Seema ji, are you there?
Yes, ma'am.
So have you understood the activity, or you want me to explain the activity once again?
Yeah, ma'am. Samajh aaya. I think please if you can repeat for me, ma'am, because
I think I will do that. Yeah. So I'm going to put all of you in breakout rooms with one partner. So like there will be two people in a breakout room, and you get 3 minutes time. In the first minute, one person will speak and the second one will be listening. Okay, let Priyanka also join.
Yeah, thank you, ma'am. Thank you so
This
much.
is something that's not acceptable. Joining late is not acceptable.
I know.
I mean, I'm very, 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 strict about it. It's better if you don't join and you watch the video, but if you join, please be there 5 minutes before 8 o'clock. Yeah. So Priyanka, are you there? Dr. Priyanka, have you joined? Okay, so I am going to create the breakout room. You will get the option to join. आपको वो join का बटन दबाना होगा. और मैं एक बार रिपीट कर देती हूँ सीमा जी आपके लिए भी. The activity is that you will be in pair. Then you get 3 minutes time to do the activity. In the first minute, one of the partner will be speaking and the second partner will be listening. Then in the second minute, the second partner will speak and the first partner will listen. And the prompt for discussion is the purpose of joining this program. Why did you join this program? Or how are you planning to use this program in future? That's the discussion you need to make. So I'm going to create the breakout room and you will get the option to join. I request all of you to join the breakout room.
Sure.
सत्यपाल आपको ज्वाइन करना है ब्रेकआउट रूम. Dr. Praveen?
Yeah. Sorry, I forgot passcode. That's why I came through this.
No, it's okay. It's all right. See,
you can tell me the password. I'll join through laptop. That is already open.
I will share that. I actually have emailed you. I will do it once again. Okay. So everybody is in the breakout room, and once they come back, then you will know what is the activity going on. Okay. Give me a minute to.
I was looking in WhatsApp. Basically, I should have looked in the mail.
I have emailed it. If you check your email, you will get it.
Shall I go and check it?
Yeah. Please, yeah. You can stay. Keep your stay logged in. But once you join laptop,
I'll check the mail.
Sure. So you still had 60 seconds time, but I think you exited the breakout room. Could you do the activity? All of you could do the activity?
Yeah, ma'am.
Okay, okay. Let everybody come in.
We had some more time. Seema quit the room and I was alone.
Yeah, I had given 60 more seconds.
Because I got the option of leave now, so I thought the time is over, so I just clicked the leave now option.
Could you complete the activity?
I think,
Not
I understood, I think we both of us understood, the aim of joining our.
But that's okay. You will get more chance to interact. Okay. Okay. Let everybody come in. Wonderful. So, would anybody like to unmute and share your experience? Keep it brief. What was the experience?
Mariam, would you like to say, or should I?
Anyone who would like to share.
Okay. So, madam, synopsis of the reason why people had joined is...
No. That's not the answer I'm looking for.
Okay.
The experience of meeting each other for just 2 minutes in person.
Yeah, I want to share, ma'am, because I know that Dr. Jayapriya, is one of the, candidate, who's attending this program. But, getting interact with her, this is first time.
Yes.
And really, we both enjoyed a lot because she heard from me and then I just listened, and the way she's interacting and what is her passion. And, she was very happy that, we are interacting with each other and we are sharing our, the experiences with each other. So this is a very good experience, ma'am, that I know Dr. Jayapriya personally now. And we have rapport. So I think in future also, if we want to interact with each other, we can do that.
Wonderful. Thank you. Yes, Dr. Jayapriya, and then Mariam. Yeah.
So the same thing here. See, I could get to know her personally.
Yeah.
And then in her own words about what she feels about this. So her aspirations and her dreams of the future. And same, I could share mine also. And somewhere, somebody mentioned that there's a common ground.
Absolutely.
Yeah.
Absolutely. Wonderful. Thank you. Yes, Mariam, do you want to add something to what they have shared?
Yeah, it was good to interact with Dr. Mehul. He was so inviting to speak me first. Was a good gesture that helped me to build a rapport.
Mm-hmm.
Yeah.
Wonderful. So could you all see that within those 2-3 minutes you were more closer to each other, you knew each other a little bit more comfort was created? Now imagine if this is the state of affairs, when patients come to us, for us that hospital and our setup is something we're very comfortable about, we are very familiar about. There's no any kind of fear or anxiety in us. But when patients come, they come with lot of concerns, anxiety, fears, concerns. And if there is somebody who's ready to talk to them and make them comfortable and check what exactly is their concern or what is bothering them or how can we help them, that itself actually makes a wonderful beginning for the patient and for you as well. So comfort and familiarity is not only required for the patient, for us also, because there will be times when you will have to speak something very, very maybe painful or difficult. So you really need to have that confidence and courage that I can talk to my patient about this. So that's the beauty of building rapport. So Dr. Praveen, actually we did a small activity. We actually are discussing 5 essential skills that we all should have with us while working with patients and with our fellow professional. And the first skill that I'm emphasizing on is building rapport. And I made everybody, go into the breakout room. Somebody's device is on unmute mode. Can I request you to put on mute mode? So they all interacted with their partner for 2 minutes, and we can see that now there's more comfort, more familiarity, more ease between people. So same way, if we build rapport with our patients and their family members, they become comfortable, and they start having that trust that, okay, people here are very helpful, very nice, very good. And also, building rapport does not require time. It requires intention. It requires, do I want to build rapport? A lot of time we work, but we work very mechanically. We don't care much to build rapport. We think that it's my duty to do, I'm doing, and that's all. And also, is it becoming friends with the patient? Is building rapport becoming friends with the patient? No. There's a difference between being friendly and being friends. You are friendly because you want to create comfort, but you are not being friends with them. We maintain that professional distance with our patients and their family members, but still we make things easy and comfortable and kind of helpful for them. That's the whole idea. Yes, Dr. Mehul.
Probably that's the difference between empathy and sympathy.
Also, if we are friends, then we talk about things that are not required, or we would talk about other things that may not only help, but also can create transference and counter-transference with the patient. Here we are very clear that we are here for a professional reason, for a therapeutic purpose, but at the same time, we will maintain that distance so that we are at a respectable distance from each other. And there are certain topics we will talk, and there are certain topics that are not required to be discussed. So no personal information is exchanged just to make each other comfortable. That's the whole idea about it. Okay. Now, I want each one of you to write one point that you think will help us build quick rapport. 1.1% write in the chat box. Okay, I can see a lot of answers coming in. Smile, yes. Eye contact, smile. Eye contact, greeting. Eye contact and greeting, smiling face, nodding, yes. Start with small talk, very good. Smile, say, how are you? Okay. So, take a situation, you're sitting on your table, a patient comes in, give attention, okay. Calling by name with a smile, yes, that's also a wonderful way, because then the patient feels, oh, the doctor knows my name or the nurse knows my name. So that gives them that comfort that somebody's, familiar with me and my name. Privacy, of course, we will respect privacy. But when you are building rapport, I think some of the things that actually do not take time, but you just have to be mindful of. For example, you are sitting in your chamber or on your table and the patient comes in. You're doing something. Patient walks in. You don't lift your head. You don't look at the patient. You don't make eye contact. You don't even nod or greet, or even when they greet, you don't even respond. You're busy doing something, just standing on your head. A lot of time we see this happening, especially, for example, at the front desk. Patient would walk in or their family member will walk in. Genuinely, the front desk staff is doing something. Not that they are pretending, but they're actually genuinely occupied doing something. But they're standing, the patient or the family member is standing, but there's nobody to kind of even look at them or to acknowledge their presence. That is one way. And the second thing is, somebody walks in, I lift my head, look at the person and make eye contact. And usually patients would say namaste or good morning or good afternoon. You just respond to that, good morning, come in please, sit down. and you show them where to sit. Just 1 minute, I'm doing something. Can you please wait? And then I continue doing something in case if I'm doing something very urgent that needs to be done. For example, I'm just completing a task on the computer and that file has to go. There's nothing wrong if I make my patient wait for 10 seconds, 15 seconds. Or if there's something that can wait, and I say, okay, I can do this later. Tell me, please, how can I help you? And within the first 1 minute, you have been able to build rapport with your patient. So every time when your patient comes into your visual field, when you give them prompt attention, when you look at them, when you respond to their greet, when you smile if it is appropriate, if they're not in too much of pain or any serious illness, if you smile and you offer them place to sit, and then of course then you introduce yourself and you say, especially if you're meeting for the first time, and if you say, tell me please, how can I help you, or tell me what brings you to the hospital today. So a small talk before the big talk, and then you take the patient's introduction. A lot of time error happens, you don't know who is the patient. When a wife comes with her husband, we think wife must be the patient, husband must be the attendant, because that's our way of looking at situation, that it's usually the wife who is unwell and the husband who brings the patient. It could be other way around also. Taking patient's attendant introduction. Why is that important? Why is taking patients and attendants introduction important?
Because it's important to know the attender, how they are related or how close they are to the patient.
Absolutely.
Because vital information is being shared in the consultation.
Yes.
So yeah, there are times we need to know if the patient is comfortable sharing information in front of them, or they
Absolutely. Can we share this information? And a lot of time, the presence of an attendant can actually interfere with your patient's expression of their problems. They may hesitate, they may fear, they may have their reservations, they may feel that I may be, unnecessary, quoted somewhere, so they may not share their information in an honest manner. Neha, do you want to say something? I think you rose your hand.
Yeah, when we don't know who the attendant is, sometimes we can get into an embarrassing situation. You assume the person, if she's a female, it's his wife. It might be his sister. It might be his brother's wife. So there are lots of variables, and it's always better to ask. And if you can even observe the inter rapport, even if they're husband and wife, if you feel there's a hesitation, you can put one person out, request to go and then talk to the patient.
Absolutely, absolutely. I think that's the reason why we should first of all identify who the patient is, and when you identify, it's very important to ask what is your name rather than asking is this your name. I remember I was taking a session for a group of nurses. So one of them said, I am in an injection room, and a patient came in, and I asked, are you Geeta? The patient said yes. She said, I had a slip in my hand that had Geeta on it. The name written on the OPD slip was Geeta, and she had to receive anti-rabies injection. She said I gave her the injection, and later on we got to know neither she was Geeta and nor she was bitten by a dog. But because the way she checked her name, the patient, usually you will see they will nod yes, even if they sometimes don't understand the question. So it's very important to ask what is your name. So I'm sure they will not tell a wrong name. They will give you the right name, and then from there you can. Yes, Dr. Praveen, go ahead.
Sometimes the attendants are overbearing. They don't allow the patient to talk at all. तुम चुप
Absolutely.
रहो जी, मैं बताती हूँ. This is a very common talk. I just give a smile and look at the patient. Patient starts talking then. Let me hear from him. Because the first hand information is most important.
Very right. You are very right. Especially with geriatric patients and with pediatric patients, even we interact more with the attendant than the patient. Whereas it is very important to, speak to the patient directly, even if it takes a little longer or it is more, it could be little time consuming, but it's still always good to, connect with the patient directly. Of course, that makes them more, open up also. So that's how, building rapport essentially does not take time, but then if you are able to build rapport, like Dr. Mehul said, half the job is done. If your patient starts having that trust in you and opens up, then it is so very easy to it paves a good way for the further relationship. So that's one skill. The second skill that I really wish, like I think Dr. Priyanka has been talking about it number of times in every session she talked about it, and that is listening attentively. We have a tendency to do more of talking. Somehow we have assumed that if we are doctors or nurses or whatever position we are holding in healthcare, we have all the right to talk and the patient has to listen. Actually, it is the opposite way. If you allow your patient to speak and you listen to them attentively, a lot of information can be obtained that can help you make right diagnosis. Studies suggest if you ask open-ended questions and if you allow your patient to speak and you listen to them attentively, almost 50 to 80% of the diagnosis can be made just from the patient's narrative. But usually we don't allow the patient to speak. Yes, Dr. Priyanka, you wish to say something?
I'm so sorry I got late. But in the world of AI in the future, is this doctor-patient relationship going to get lost? Because I'm seeing that the consultation times are getting shorter. You have to see more number of patients, and the patients are also just straight away coming with the diagnosis. Whereas still the clinical acumen is in the consultation, asking the right question, open-ended. So how will things be?
I'll give you an example. My husband is an ophthalmologist. So there came a patient. He said, "Sir, I frequently have eye infection. Very frequently, almost every 1 month I have eye infection. I take medicine, the infection becomes fine. Then again, after a few days, I will have..." And to look at the person appeared quite educated, clean, well-dressed. I mean, there was no challenge with his hygiene factor or anything. So my husband again wrote some medicine and, was about to bid him bye. I was standing there by the way. I asked him, do you do something with your eyes? Anything that you do with your eyes? Anything that you add? He suddenly recollected. He said, there's an active exercise in yoga. We get eye cup. And I put water in that eye cup and I clean my eye like this. I mean, we are taught how to do it and I do that. And then I asked him, I said, then what do you do with the cup after you have done that activity? He said, I just throw the water and I'll keep it upside down. That's all. I said, do you wash the cup? No, it's just water. I throw the water and I... See, AI is greatly helpful. I have no doubt about it. And I'm very optimistic about its help to us in making right diagnosis. 40% of loss in Western world is because of the wrong diagnosis. But human touch can never lose its power. Because the language of touch, the language of empathy, AI cannot replace. Dr. Devi Shetty, have you heard of him? Yeah. Almost everybody must have heard of him. So in that book, Communication, Care and Cure, he wrote, he when he came to India, he started his practice at Kolkata before he started his practice in Bangalore. He wrote in that book that I used to see 100 patients a day. He was called operating machine in UK, if I'm not wrong, because the number of surgeries he used to do, people used to say that it's humanly not possible, but the way you function. So when he came down to India, he started his practice at Kolkata, I think Birla Hospital. He wrote in a book that I used to see 100 patients a day, but not even a single patient initially got ready for surgery. Then he introspected. He said, my way of handling my patient was very mechanical. He worked on himself. He changed his way of interacting with patient, rest is history. Now, if you will see some of the videos that he talks about the importance of human touch, he says, even if you know the patient's pulse is not normal, it's going to be right, you still need to hold your patient's arm and check the pulse. Even if you know the BP is going to be normal, put that cuff and then do that exercise. The amount of satisfaction that patient will get from your touch and your interaction and your attention is going to do more healing than the actual treatment.
Fully
So
agree.
please don't
I fully agree that nothing can replace a thorough medical examination and a full total history.
Absolutely.
Many times, all those people who use AI, they'll first look at MRI before examining neurological. So I'm an old timer. I said that you keep your files here. I'll look at the files later on. Let us first talk. Tell me your story.
Yes.
And then
absolutely.
I'll keep on asking what else, what else, what else. Till he stops, then only I'll start my dialogue. Because there's a study that on an average, a doctor interrupts a patient on 18th second.
Yes. Now it is 13. The latest studies say 13 seconds.
13 seconds. Okay, we have progress.
So if you allow the patient to speak and if you listen to them attentively, you can get a lot of information. Patients get a lot of satisfaction if they are heard. I get to hear from many patients that I wanted to tell about my problem, but doctor did not. We saw that survey report in the first session, if you remember, that almost 45% of the patients and their family member, they said that it was a rushed consultation. We were not given enough opportunity to talk about the problem. So definitely they're bound to be unhappy with us. So let's do another activity, and that's about attentive listening. So at random, first I will be picking how many of us are there. Okay. So I'll be picking 6 of you and I'll be putting you in the waiting room. And then I will add you to the breakout room. So I'll speak to the people in the waiting room in a minute, but I will first take you to the waiting room. Give me a second to take you there. Okay. So Archana, I'm taking you to a waiting room. Bobby, I'm putting you in the waiting room. So I'm not picking anyone whoever name is coming in. I am taking you to the waiting room. Next is Priyanka. Okay. Jaya Priya. Siyog, I'm not adding you to any group because you will be probably logging out anytime. Okay, Lavanya, I'm taking you to the waiting room. So we have how many people? 5 people in the waiting room, then 1 more can go. Mariam, I'm taking you to the waiting room. Okay. So how many people are there? 6. And now we have 6 of 1, 2, 3, 4, 5, 6. Okay. Now let me first explain the activity to you all. So I am going to bring those members to the breakout room where all of you will become partner to them. They will be sharing a story, whatever they want to say, but you don't have to listen to that. So it could be you could start talking on phone, or you could switch off your video, or you could just sit like this and not pay any attention. Whatever you do, that's your call, but you don't have to listen to their story. That's the act. Is that okay? Is everybody clear? Okay. So I am going to the waiting room. So give me a second to. It will take a minute because it's little longer process. So I am putting all of you in the breakout room first. Please join the breakout room. So have you got the message to join the breakout room? Not yet? Okay. Give me a second, please. So how many of us are there? 1, 2, 3. Is everybody's video on? Okay. There is some challenge with the breakout room. So I am getting them in and I am going to talk to them in front of all of you and give the same instructions. I'm admitting everyone.
Probably, madam, now put us into the separate room. Probably that might work.
Yeah, but let me give them the instructions. So who all were outside, please raise your virtual hand. Virtual hand. Please raise your virtual hand. Who all were in the waiting area? Yeah, 1, 2, 3. Okay, 4, 5. I think there were 6 people who were outside. Archana, you were also there. So you can raise your virtual hand. Can you do that so that I know? Okay. Okay. So those who were outside, you have to share an incident where your patient and their family member were really, really very happy with your work. They complimented you and they even, went to the extent of saying you thank you and talking about you to others. I'm sure something like this all of you must have experienced. Mm-hmm. So I want you to share your experience with your partner when I put you in the breakout room, and share your experience with them. Is that okay? So is 1 minute enough? Will 1 minute be okay? Or maybe 2 minutes? Okay. So you get 2 minutes time. Meanwhile, you can think of and let me create the breakout room and share with send all of you one by one. Yeah. Give me 1 second. Okay. Another minute. Satyapal, you were here or you were in the waiting area? सत्यपाल आप हो?
मैं हूँ, मगर मेरे कुछ नेटवर्क इशू आ रहे हैं। मैं बार बार मेरे पास लीव हो रही क्लास में।
अच्छा, तो फिर मैं आपको नहीं डालूं किसी ग्रुप में?
जी मैम।
मैं आपको डाल देती हूँ, देख लेते हैं।
मैं वाईफाई भी कनेक्ट कर लिया, मोबाइल का भी देख लिया, बट
ठीक है, मैं डाल रही हूँ आप लोगों को। यू कैन ज्वाइन दी breakout room and you get 2 minutes time.
मेरा पहला सेशन भी नहीं हो पाया था सर के साथ, जो होना था वो भी नहीं हो पाया कुछ नेटवर्क प्रॉब्लम की वजह से।
अभी आपको मैंने ऐड करा है किसके साथ? आप मरियम मैम के साथ ज्वाइन कर लो। हाँ, ज्वाइन कर लो। आप वीडियो ऑफ कर लेना।
Madam, we're back.
But actually, I couldn't talk to my partner because she was not audible or anything. I was waiting for 1 minute. She didn't speak anything.
No problem. My partner was not interested. I also didn't say anything. It's okay. That's the exercise, I guess.
Okay. So you have all exited? You have all come here?
Yeah.
No, I think maybe still they're waiting to the partner to speak.
Okay. So how come you three were, you were in different breakout rooms or you were together?
No, we were in different breakout rooms.
Okay. So Dr. Mehul and Dr. Priyanka, you were partners, I believe.
Yeah, I can suddenly not see everybody.
Okay. And Archana, who was your partner?
Yeah, I tried messaging her. I said hi quite few times. I messaged her.
She was there or no?
She was there, but the video and audio both were
technical issue.
Let's see if it was a technical issue or what it was.
Yeah. I am waiting.
Okay. So Dr. Priyanka, what was your experience with Dr. Mehul?
So I actually introduced myself like I always do. Started talking, but he was a little preoccupied. So I thought I will wait. I started telling my story 2 times, but then because he was supposed to be acting that he's not interested, he was showing me his passport, he was eating something, he was talking on the phone. So I let him finish his work, and by the time the time was over, so I was not able to complete my...
So you didn't get a chance to speak?
No, I would have, but the time was short. So I was actually waiting to get his full undivided attention.
I agree. So those of you who were sharing their story, again, please raise your virtual hand. Those who were sharing your story, please raise your virtual hand. Archana, so what was your experience?
I tried, talking to Neha. Hi, Neha. Hello. There was no video actually. So that is also one of the reason I couldn't speak anything because I was not understand. I was thinking it's a technical issue, but maybe that's and I messaged her also on the chat, direct message on the chat also to understand whether she's able to hear me or not. I didn't get my reply, and as it was already above 1 minute, so I just...
Okay, great. So Lavanya and Dr. Praveen, who was speaking out of you two? Lavanya, were you the
ma'am, I was in the breakout room with Miss Seema.
Okay, Seema ji. Okay.
Hanji.
And
my experience is a little different, as in what my 2 fellow participants have shared, that they were unable to give, they were not even at all given a chance wherein the person was not at all looking at them. However, I had a different experience. She was asking me, she was probing me. However, she was not giving any attention. She was looking here and there, and as in it was, I felt like it was a formality कि पूछ तो रहे हैं लेकिन सुनने में इंटरेस्ट नहीं है ज्यादा. So I also turned, instead of getting into all the details and everything, I also switched to ठीक है point to point रख के खत्म करते हैं.
Oh, my video is off. I didn't realize. I'm so sorry. I forgot to have my video on. So it was to give a feel to all of you how your patients feel when you don't pay attention to them. They can make out that you are not listening, you are not interested, you are busy, you are preoccupied. This was just to give a feel of the, pinch that the patient experiences. They can sense that you are not paying attention. And how you feel when you have something to say and it's there and you're not allowed to speak. So I think one quality that we need to really, really work on is attentive listening. Now, I request all of you to write in the chat box, how do you demonstrate attentive listening? How do you demonstrate attentive listening? Write in the chat box. Okay, eye contact. Avoid distraction. Okay, eye contact. Body language. Lean forward. Nodding and eye contact. Not using mobile. Okay, reconfirming, absolutely. Nodding your head. Okay, repeating or rephrasing, absolutely. Sitting next to the person, or at least sitting in a place where you are face to face with the person. Avoiding non-verbals or avoiding non-verbal gestures that shows distraction. Okay, smile is fine. Distraction has to be avoided. Yes, exactly. Asking related questions or asking questions that are related. Okay, ask them to repeat what you have said. So again, you are kind of reconfirming what the patient has said. Asking open-ended questions. Make sure that they have understood. Okay, so that when you repeat what they have said, it more or less confirms that if they think that you have really understood.
I wanted to tell you, my son, it is ulta for me, because he'll be telling something and I'll be attentive but doing multitasking, and he feels I'm not attentive to him. He'll say, Mama, what did I say? You're not being attentive to me. What did I say? You repeat, he'll tell me. Then I repeat. If I don't repeat, then he'll make a big hue and cry.
But unfortunately, patients can't say this to us. Can you repeat what I said? Have you really heard me? So therefore, they have to just take it with a pinch of salt, but they can sense that we are doing multitasking. So definitely, if you are not giving 100% attention, you will never be, actually getting the complete message from the patient. So verbally encouraging with the monosyllables like, yes. So that means you are kind of saying, yeah, I'm understanding. Yes, I get it. So there are so many ways to demonstrate active listening. I think the first one is face the person. A lot of time, if you are facing on left or right, and if you are not looking directly at the person will feel you are not giving attention. Make adequate eye contact, many of you have said. Smile if it is appropriate. So do not do multitasking. If you're doing multitasking, they'll always feel that you're not giving them 100% attention. Put things on hold, at least especially when you are making the initial this thing. In case if you're simultaneously writing something on the iPad or on the laptop, inform the patient that I am adding your information to the on the laptop, so in between I'll have to do it simultaneously. But in between, make sure that you make adequate eye contact so that they feel that yes, you are paying attention to them. Like one of you have mentioned, lean forward. Posture plays a very big role. I think we discussed in the last session. The way you sit communicates how much concerned you are. And then if you lean forward, nod in between, that shows that yes, you're listening, you're understanding, you're agreeing with them. Avoid interrupting, especially in the initial few minutes when they are talking about their problem. If you allow them to speak and you listen to them, they feel being heard. After that, you can ask any number of questions and you can, but then initially, if you give them that 1 minute to narrate their problem, and especially if there is something that you want to clarify, you think you need to know more, just note down that point. And then after they are done with it, and if you say, okay, you talked about this particular thing, can you tell me in detail about this? Can you tell me more about it? So you can get more information. But in between, don't interrupt and ask any question, because that would break their flow. So again, attentive listening is not easy. Mind wanders. That's why we also lose attention, and we also start thinking of things. But if you simultaneously keep noting down what you are going to ask or say, then it will keep your attention to the point. But I think there is nothing like attentive listening. There are so many helping agencies where they just listen to the person for the person, for to help the person vent out, because a lot of time just listening plays a very therapeutic role to the patient. So that's second skill that I want to really request all of you to keep handy. Third skill that I would want all of us to work on is positive and helpful attitude. So we all do things, we do everything what we are supposed to do, but what is our attitude and what is the intention of doing that? That decides the quality of the outcome. So I'll just give you a small example, a story, and that will tell us how our attitude can change the outcome of a situation. So there was a building being made, and there were some, laborers who were doing the work over there. So one of the person who was just passing by that road stopped on the way and looked at one of the laborers, and he asked, "What are you doing?" So that person, in a very kind of neutral way, he said, "I'm making my livelihood." I'm making money. I have to feed my family, so I'm here to make money. I'm doing my job. That's all. So a lot of us work for money, which is not wrong. We all know that we require money for our livelihood. But if that's the only purpose of our work, then you can well imagine what will be the way we will work. Then he goes to the second person, second laborer, and he asks him, "What are you doing?" That person was quite frustrated and unhappy. In a very, bitter tone, he says, "Can't you see? Are you blind? Can't you see that I'm breaking bricks?" And again, many of us work. You see people around who work with a lot of irritability and dissatisfaction, and always they're complaining, blaming, unhappy, dissatisfied. I mean, whatever you do, they'll always be unhappy. So we do come across those kind of people also. Then he goes to the third one, and the third one, he asks, "What are you doing?" So he takes this person to the side of the building that was being constructed, and there was a huge map, and actually it was a temple, being built at that place. So with a lot of pride, he says, "We are, constructing a very huge, beautiful temple, and I'm constructing that temple." Now you see, same task, three people doing, but with different mindset, different attitude, different intention. The quality of their output will be entirely different, because when you do things mechanically, you are not 100% into it. When you're doing with unhappiness, dissatisfaction, frustration, you're creating negative energy, negative hormones, negative health, stress. Anything and everything that you will do will appear stressful to you. But if you're doing things happily, if you're enjoying it, if you're proud of it, if you're very positive and optimistic about it, you will create a different set of energy, different thoughts, different feelings. So that's why it's very important to look at our work with a lot of positive and with a very, very, very positive mindset. And we need to be helpful to people who come to us for help. But that's one skill I think we all not only need to carry with us, but also make sure that the whole team actually works with that mindset. Then you will see complete change in the energy of your workplace. The fourth skill that I would recommend to all of you is to treat your patients with respect and dignity. With educated patients, with well-off patients, with well-to-do patients, we are all very nice, very good. Of course, there also we face different set of challenges because we feel they are very demanding or they are very dominating. But at least out of fear or respect or for accountability, we are still very respectful and cordial to them. But when it comes to handling patients who are poor or uneducated or from rural background, a lot of time our behavior change with them. We are not that respectful. We are not that kind and helpful to them. I think being respectful with the patient, irrespective of their age, caste, creed, socioeconomic status, is something that has to be mindfully brought in. So the biases and the stereotypes that we have, that these are people who will not understand, they are not educated, so they have low IQ. So these are all stereotypes that we have. We really need to mindfully overcome these stereotypes and biases, and we have to respect patients not only for who they are or what they are, but also we have to respect their autonomy and their decisions. A lot of time their decisions we may not agree with, but we can't be disrespectful to them. Yes, Dr. Priyanka, you wish to say something. Go ahead. Yeah.
I think they are the best patients. Having worked, got trained in government college, we used to have OP of 400, 500 per day. Some of the ladies will come real low socioeconomic background, and all they want is a paracetamol. That's all we will be able to give them. Just one complex one pad. But they'll be so happy, just because you listen to them. So
absolutely.
I miss those days, in fact.
I'm sure. Yeah. So handling patients in corporate sector is more stressful because there you're always, on the
now with this pre and post social media.
Yeah.
That's the thing. So you have to you have to signpost your consultation in a very clear manner so that they
absolutely. I think we have to be more professional, I think, in our approach, and that says it. Thank you. Yes, Archana, you wish to say something. Go ahead.
Yeah, actually, I speak to a lot of NICU mothers. I would say I handle NICU mothers a lot, and there are a lot of mothers who are like very, very, matlab, they doesn't know anything at all. But I feel making them understand is more easier than handling a high profile case.
I agree.
मेरे साथ एक MP का बेटी डिलीवरी होके 25 weeks, she is in a NICU, and another auto driver's family, twins के साथ NICU में है. For me, the auto driver family was very easy to understand. 1, 2, 3, 4. These are the points. You just follow.
Yeah.
I didn't have any problem with her. But the other high profile family, I used to spend hours and hours with them, and there was nothing to be explained for hours and hours. There are only 4 points she should follow, but I mean, I had a very tough time handling them simultaneously. Actually, I used to finish this person within 10 minutes, but this person used to take a lot of time. So
I agree. So sometimes high profile patients have a lot of high expectations, and it becomes difficult to satisfy them. Absolutely. Absolutely. But again, with both the patients, we have to stay neutral, very non-judgmental, and we have to understand from where they are coming and why they are behaving.
Exactly.
We can't be unhappy with them. We can't be unhappy with them that you have a lot of expectations. So that's not fair. That's the whole idea of being non-judgmental. Yes, Dr. Praveen. Yes.
Yeah. Many times while taking the history, we become judgmental listening to the history. A cirrhotic patient comes and he says that I have been drinking alcohol, and suddenly the tone of the doctor changes. Someone comes, HIV is positive, and you suddenly become less friendly. That also should not be done.
Absolutely. I completely agree with you. And that happens so automatically that we also don't get to realize that we have changed our way of handling that patient. And I agree with you that very mindfully we have to learn to be non-judgmental, and we have to learn to be objective. Absolutely. Point well taken. So that was point 4. And the 5th one is empathy. 5th one is empathy. What is empathy?
Empathy is something putting yourself in the shoes of the person and feel what he must be feeling. Not necessarily that he be sad, you become sad. No, it's not so.
Yeah.
To understand how is he feeling.
So being sad with the patient is absolutely not empathy.
Not empathy. Yes.
Absolutely not empathy.
Yes. But you have to understand how is he feeling. Basically, the one word we can define is that putting yourself in the shoes of the person.
So but at the same time, I want to ask here, because now this thought process is being challenged. For example, if I'm a man, and if it's a lady who has come in labor pain, being a man, I will never be able to put myself in her shoes.
Still, we can understand feel the pain. Pain is pain.
Yeah, that's what I was about to say. If you can, feel in tune with the patient's affective state, you are able to
put yourself in other shoes. It is sympathy.
No. That is empathy. That is empathy.
That is empathy. Okay, let me
sympathy is different. Sympathy is totally different.
We experience 4 emotions in a workplace or in any situation. We experience 4 emotions. Now, one is there's a patient who comes in pain. I'm busy doing something. I continue doing. I make the patient sit for 5 minutes, and I say, okay, give me 5 minutes. I'll attend to you. But I take good 5-10 minutes finishing my work, hoping that let me be over with this, and then I will attend this person. And I don't care if the patient is rolling in pain or there is some problem. This is called apathy. When you are not able to understand the person's, what the person is going through, this is apathy. Now, this person is very angry with me that I did not pay attention and I'm not even ready to, take any action and, leave what I am doing. He comes up to me and he literally, argues with me on this, that what is this? You're not even paying attention. What is the point of coming to the emergency? If you make the patients wait for 20 minutes, I'm going to go and complain against you that you are acting very irresponsible. I'm very annoyed with that person. And I say, I'll make you wait for another 10 minutes because you have insulted me in front of everybody. So you're not going to, just go like this. This emotion is called antipathy. Antipathy. The third is a lady comes in with a child is unwell, has high grade fever. The lady is crying. Seeing her cry, even I start crying. That is sympathy. Empathy is if I can look at the situation from that person's point of view, and if I can sense how painful it must have been for the person. The beauty of empathy is that I just don't only feel attuned with the patient's feeling, but I also know that I can take a step to relieve the suffering. So I immediately start thinking, what can I do to reduce the suffering of this patient? That is empathy in action. But a lot of time we get to hear in healthcare, people are not empathetic. So recently when I did this program I do program for Maulana Azad Medical College. So this year, in the last, say, for example, for more than 100 students, I gave them a questionnaire on empathy, just to see how much they know or how much do they really understand and how much are they really able to apply when it comes to patient handling. Very honestly, a lot of them do not have even clarity on what is empathy. Forget about its application. The understanding of the word empathy is not very clear. Also, a lot of time they feel empathy means attaching yourself with the patient. And they say, no, no, no. Our seniors have taught us you don't have to attach yourself with the patient. They need to have this clarity. Empathy is not attaching, but not attaching is not equal to detachment. These are altogether two different terms with different meanings. You don't have to attach, but you don't have to be detached also. So that's the beauty of empathy. But we do see people are not really practicing a lot of empathy in healthcare. I hope you agree with me.
Non-judgmental and sensitive, because these are only the two words which always, anytime I talk to a new patient, just I remind myself, be sensitive, non-judgmental.
Absolutely. Yes. These are the foundation pillars for any patient counseling and communication tools. Yes, Dr. Praveen, you wish to say something? Yeah.
Detachment in attachment is a Gita ka shlok mein hai.
Yes, absolutely. Yeah. So do your karma without...
That is the message Lord Krishna gives us. Absolutely. You do everything for your children, but don't get so much involved that you lose yourself.
Yeah. And don't attach yourself to the reward. That's also the message Gita gives. Yes, Dr. Priyanka. Yeah.
After these sessions, I think we will become better partners, better parents, not only better professionals.
Absolutely.
Because you have to change yourself.
So more you will work on yourself, you will feel purified. You will feel that you have become a better self of yourself, better version of yourself. That's the beauty of such interactions, So thank you so much. I think these were 5 skills I wanted to emphasize. So whenever you are doing any program for your, healthcare professionals, teams, you can even pick up these 5 skills and start your discussion with them, because this is to the point. There can be many more. There can be many more, not just 5. But if you start with these 5, you lay a foundation for your trainees that, okay, if I have these 5 skills, I think I'm good to go. Building rapport, very important. Listening attentively, being respectful, positive and helpful attitude, and empathy. So that's why I thought that I will conclude this session with these 5 skills, because it's easy to remember the number and also the name. And then it will be easy for you to deliver also to your team. Any questions about this before we move to the second topic?
Ma'am, I have a question. So I have been clearly able to understand the 4 emotions that we feel in our workplace. Just I have a little doubt. So is compassion also in link with empathy, or it's an altogether different concept?
Compassion is application of empathy. It's an extension of empathy.
Okay. And if also you can add a little bit on more, as in when, like, I'm a trainer, so I would be talking about these concepts to my participants. Yeah. How can we make them practice compassion or empathy so that they're actually able to put it in the real situations?
See, whatever skills you are talking about or whatever we have discussed, if you put them in application, that's nothing but application of empathy. So if you can Look at the situation from the patient's point of view. You will listen to them. You will, like Dr. Priyanka said, you will remain non-judgmental. You will not label them. You will not cut them. You will not find fault with them. Like Dr. Praveen said, even if they say that I have HIV, or I was an alcoholic and I'm out of it, or I was into drugs and I'm out of it, you will stay non-judgmental. Your behavior towards patient will not change. And then your focus will be on how can I help my patient? How can I make my patient's life better? That's the true application of empathy. Being respectful, being non-judgmental are nothing but applications of empathy. Compassion is when you are wanting to go an extra mile to see how you can help your patient. For example, if
Absolutely
patient
agree.
says, I can't afford it, and if you think you have a provision to provide some financial concession to a patient who is needy and who's really not in position to pay, and if you are able to leverage that and provide that service, that is compassion, that is empathy and compassion. Yes, sir.
I have noticed one thing, that whenever the patient walks in, if you have got that attitude in your mind that let me listen to what is problem and
Yes.
how much I can help him. If we have got this attitude, then everything, words, non-verbal, body language, eye contact, empathy, everything falls in line.
Will fall in place.
You have to just have that feeling, how can I help him?
Yes,
First, let
yes.
me listen what is his problem, understand it, and try to help him.
Yes.
With that only it works.
And also, like Dr. Priyanka said, being non-judgmental. So in counseling also, a lot of time patients would suddenly reveal something that otherwise would come as a shock to anybody. But then if you start practicing being non-judgmental, after a while you become very very good at it, very mindful of it, that I don't have to judge the patient, but I just have to focus on how can I help my patient get the best out of their life. That's all. Yes, Dr. Priyanka, I think you wish to say something.
Like, especially in my field, gynecology, we get nowadays a lot of young adults, even at the age of 18, 19, who are coming for contraception advice. And
Yes.
there is an aspect of confidentiality also.
Yeah.
But they don't want to be, us to be preaching what is right, wrong. So you have to very gently lead the conversation, where you are telling them that, okay, you are doing, this is what you are, asking for, but these are the, risks and things like that. So it sometimes has to be really gently led.
Absolutely. So again, see, these are situations when you really have to be very mindfully, you have to stay non-judgmental. A lot of time relatives, when they say, we don't want to resuscitate the patient, or we don't want the patient to be moved to ICU, but we want to take the patient home. So for a minute, you might think the patient doesn't want to spend the money. What is the point? These parents must have spent a lot of money in rearing these kids, and now they don't want to, spend money on their parents. But we have to learn to stay non-judgmental and be respectful of whatever decision they take, because there must be good reasons for them to decide that. Okay, so moving further, the topic of discussion is, how do you go about designing a program? This topic has been included in the program because I believe that all of you need to become, trainers simultaneously, because you intend, one second. Yeah. So you need to really, keep in mind when you are going to design a program or deliver a program, how do you go about scientifically doing it? Right now, if I ask you to write in the chat box, what all steps do you take to design a program? Write in the chat box, what all do you do if you are asked to do a program for your team or for your hospital or for any, what steps do you take? Write in the chat box. So I can see a lot of good answers coming in. Okay, know your participants. Okay, assess the knowledge first. Okay, first understand the group. Great. Ice breaking. Plan, prepare, propagate. Okay, scope of training. Understand the group. Assess what they know, pre-test. Training needs identified, if any. Okay, first write what you want to be the outcome of the program. Okay, content, backgrounds and how they can become trainers. Okay, topics to be covered, deliver, audit, revisit. Okay, outcome from training, and then training method. Give a brief about communication, show some videos, some activities. Okay, ask about their expectations, give program schedule and number of sessions. Okay, so you can see, I mean, if I add everything that all of you have given, you have covered almost everything. So that's the beauty of getting so many answers, in one go. You get a lot of information. So this session, I'm just going to give you briefly a very simple structure that you need to follow. Of course, there can be more that you can add to it, but I'm just trying to give you the whole information in a structured manner, so that if you follow these steps, you will have a better prepared program, and then definitely you can keep adding to it. Then Bobby has written preparing of audiovisual aids and planning group activities. Yes, that's a very important step in designing any program. So let me quickly share the presentation with you so that we can simultaneously have a look at the slides and have the discussion around. Give me 1 second to, okay, there we go. So key questions that you need to first of all ask yourself when you're going to design a program is, who is my audience? Because your whole program content, delivery, message will change on the basis of your audience. If this program is for doctors or nurses or front desk staff or housekeeping staff, whoever it is, the first question that you need to clarify is, who is my audience? Of course, we'll be talking about audience in the later half also, but first thing is, who are they? Then what is the goal of training? Why we need to do this training? Then the third question is, what is the message that you want to give to your audience? What is your core message? And then how are you going to communicate this message in an impactful way? So these are the 4 questions you have to first answer before you actually go ahead with actually designing a program. So how do we do it? We will be talking about it in a while. But again, before you actually design a program, you need to have training objectives. How do you normally find out what is the training objectives, or what could be different training objectives? Write in the chat box. What do you think? What could be the different training objectives? Write in the chat box. I am not able to, okay, now I can see. I was not able to see the answers in the chat box. Okay. Train the trainer or understand the importance. It could be now knowledge transfer.
Unable to open the chat box.
Yeah.
Some other format is coming.
Is it?
Now it is there. Yes.
Yeah. Then to improve communication skills, impart communication skills and hands-on training, pros and cons. So there can be many, and professionals will learn listening skills and how to be non-judgmental. Okay, that could be the objective. So when we do programs, some of the common objectives you will see, some could be creating awareness, that you want to create awareness, so you are creating program. Or it could be sensitization. Maybe you think that there are certain areas that people are not practicing, so you want to sensitize them. It could be that you want to impart new skill and knowledge to your team members, so you are going to design a program around it. Or it could be to bring change in the attitude. You feel that their attitude towards their work and patient is not okay, so you want to bring a change in their attitude. It could be the promotion and growth, because a lot of time to grow and to become better, we plan programs like this. Or it could be aligning the employees to the vision and mission of the organization. For example, induction program, where you kind of have a set topics that you cover for your team or for your new joinees, so that they are aligned to the vision and mission of the organization. It could be about skill building also, because where you feel your team members lack on skills, so you want to build their skills. Or if you think their behavior modification requires attention and you really need to work on their behavior change, the way they conduct, that could be also one of the objectives. So how do you identify these objectives? How do you identify training needs? If you could write in the chat box. How do you identify what is the training need? Okay, you give them Google form. Okay, pre-programmed questionnaire. Okay. Okay, feedback from patients or department HOD, yes. Pre-test, okay. Ask the participants what they want. Okay, that's also one of the ways that you try to find out. True. How else can we do the training need assessment? Okay, floor observation. Yes, that's another good way. You just quietly go and observe their conduct with the patient or with fellow professionals, so you get to see what they really need to do. So, in corporate sector, they do a lot of training need assessment. Incidentally, in us, we are not doing much of this in a formal way. We just decide, okay, let them undergo some training where they learn how to conduct themselves. But in corporate sector, they actually do training need assessment. It could be knowledge, skill, attitude, or conduct. And then they particularly pick up one area and then they work on it. Okay, if any incident or ORCA. What is ORCA? Analysis. Okay, RCA, root cause analysis. Okay, I got confused that what is this? Yes. So, as I said, that training need assessment, a lot of organizations do formal training need assessment, but we normally try to get information from different sources, and we try to set our objectives based on the training need assessment. So there are many ways to find it. It could be on-site observation. You could even ask the management. They'll come up with what complaints or what feedback they're receiving. You can ask the participants or the employees what they want to learn. You could even use tools to assess. For example, if you check their knowledge level or skill level, you will get an idea what kind of input they require. Even patient feedback is a very good way to find what training your staff needs, or complaints and suggestions you receive from patients and employees. Even that's also a good way to find out what trainings you need to really undertake. So a lot of organizations use mystery customers, where they send somebody who acts as a patient or a customer, and then kind of they observe the conduct of the staff. So there are many ways to,
could you try again?
Sorry. So there are many ways to identify the training needs and then set your objectives based on that. So once you have done your training assessment, now this is what I need to impart. Next point is where you sit and do the brainstorming about what you are going to deliver and how you are going to deliver. So those of you who are seasoned trainers, they would have kind of points on their mind which they can list down, and then they can kind of put them in flow. But if you do little bit of R&D, you will come to know, or you will be able to find out what you need to cover in a particular topic. So create a bucket list of topics, the points and content. I use a tool called eDraw Mind Master. Has anyone heard of it? eDraw Mind Master? Okay. So I normally, what I do, if I have to plan a program, for any group of people, I would just use this tool, you can note down the name, and I'm using the free version. So you can also consider using the free version, which is easily available. You can download for your, laptop. So what happens in this, see, it is more like a whiteboard that we use in Zoom. So you have the main topic in the center, and then whatever ideas that come to your mind, you keep adding them in the list on left or right, depending upon the format that you want to use. So it has an option of 4-5 formats. You can see this one. Let me show you. Yeah, on the right side, on the right panel, you can see there are different structures. So write the main topic in this, and whatever ideas come to your mind, because if you just think, okay, I will sit and write, you can forget. But if you just write these ideas, and you can also write floating topics. So floating topic is when you write it random on the whiteboard, but you are not attaching it to the main area. And that's how I normally would write, all the ideas that come to my mind and put on the whiteboard. So this helps you to put your thoughts in black and white on a whiteboard, and then you can reorganize or reorder it as per your requirement. So you can, one second. Okay, so you can actually use this tool for your, yeah. Something like this you can use to make a bucket list of the topics, points, and content that you want to deliver. Now after this, now you create a flow in the content. Whatever ideas that have come to your mind, you kind of reorganize them. Something will go in the beginning, something will become part of the body, something will become the end of the program, and then whatever your takeaway is. So you reorganize this content to fit in the format. Now is the time to create your, training pedagogy. So what different pedagogies are you going to use to deliver the same content? So a lot of time we are all used to PowerPoint presentation as a way of teaching. But you will realize with adult audience, it is not easy to hold their attention. It is not easy to make them participate. It is not easy to engage them. So you really need to be very innovative in finding the interesting and engaging activities that can communicate your message in an interesting and meaningful manner. So there are a number of pedagogies. For example, role plays, rapid fire round, questionnaire, experience sharing, videos, puzzles, group activities, storytelling, and there are many, many more. There are many more which you should be able to integrate in your session, be it a physical program, be it an online program. That's how you will be able to engage your audience. Otherwise, how much ever effort you have made in designing the program, it may not have that amount of impact. So make sure that you have a list of activities around your topic and the whole program, and you integrate them at different places. So you will see every time I try to bring in new pedagogy to kind of give you an experience of that pedagogy, and also showcase you that it is not difficult to integrate it and how you can engage your participants. Now, once you have done that, now develop course material which includes handout or handbook. For example, if it's a big program, a day's program, 2 days program, then definitely you need to give handbook to your participants. If it is 1 hour session, 1 or 2 page handout is also good enough, because that there is something that they take home, and if they want to revisit the content, they can have a look at it and they learn from it. So developing course material also beforehand is very important. Simultaneously, we need to develop questionnaires for pre-test, post-test, and feedback. All 3 questionnaires are very important. Pre-test will give you an idea about their existing knowledge or their practices. Post-test will give you an idea of how much of impact have you been able to make through your training. And feedback will give you ideas to improve yourself. And all 3 are very important. So you should be ready with all 3 of them, before you do the program. Now, once you have, once you have developed everything, now execute your training, where you would be kind of, it could be on-site or it could be online, whatever it is. depending upon the format. You execute the training and then take the feedback. Now, feedback form should be as simple as possible. It should be to the point and anonymous. Anonymous, especially with the audience where you think they will hesitate giving you the honest feedback. So, like for example, in our case, I normally ask you to write your name, because in case if I want to discuss with you about your feedback, I can talk to you, and I'm sure you will give me more, insight into whatever feedback you give me. But when you do it for your participants who are not of the same position in hierarchy, they may not give you a very honest feedback. So there I would always recommend that it's better to give a anonymous feedback form, so that you get a real feedback from them. After you have done your training, after you have received the feedback, it's time to sit and reflect, going through whatever you did, what you did, how you did, what could have been done differently. Do it as early as possible, because the memories will be still fresh, so you will be able to immediately recollect what you did well, what you need to change or modify or replace, and that is something that we should do on regular basis. So based on that, we need to every time modify the program and make it better for you and also for your participants. Now, a couple of points that will help you to design a program in a more impactful manner. For example, first of all, what is the mode of training? For an online program, you have to develop your training pedagogies differently. For an on-site program, you'll have to really consider a lot of things, because if it's an online program, then probably you are in a limited arena. So you will have to really engage your audience by making them speak. But the beauty of online program is you are in touch with every participant. You can call them by name, you can make them speak, you can ask them to answer. Similarly, on on-site, I mean, there's nothing as interesting, as enjoyable as an on-site program, because being physically present in the same area itself creates a lot of energy to participate. So both have their own advantage and disadvantage, and then accordingly you have to be very mindful when you are developing your pedagogies and content, that how you are going to deliver. Audience size is also very important when you are planning your program. If the audience size is very big, and in case if you take up activity where you need to engage everybody, you might be wasting a lot of your time just engaging them. When the audience size is very small, again, for a minute you may feel, oh, there are not enough people to listen, but then you really need to again upscale your delivery skills to engage those people. But audience size decides how you're going to deliver your content. If it's a too huge audience, I normally say that it will be more like webinar, because people at the back end cannot always be engaged. Normally, I suggest that for an online program, not more than 15 people, and for on-site program, not more than 30 people. Especially communication programs are hands-on, where you need to engage them in role plays, activities, and discussion. So 30 is a good size. More than 30, it will be more like, people at the back end will be just listening or may not be even participating. So make sure that you don't have too large an audience. Otherwise, it will be more like a webinar or seminar kind of a thing. It's also very important to know who is your audience, what is their qualification, what is their years of experience. That helps you to customize your session. For example, if you are going to do the same session for a younger age group people, so you will not be able to deliver the same thing in the manner that you would do it for a senior level people. Again, for very senior level of people, you will have to really be very mindful of the pedagogies you use, the content you use, the delivery style you use. So it's helpful to know your audience, what is their age or experience or qualification or position in the system, because that's what will help you in customizing your session as per your audience. Then, how willing is the audience? That's another challenge you are going to experience, because a lot of time your audience may not be interested, especially initially. So you will have to very mindfully plan in a manner that you can actually engage them right from the beginning. A lot of time we see that the audience is not very interested, especially if they have been asked by the management to come and attend your program. So there again, something that can help you is if you can highlight what is in it for me and how are they going to be benefited. That's how you will be able to engage their attention. Otherwise, it's not that easy. But slowly, I think we all learn to manage even those situations. Another important thing that we have to please keep in mind is the time allotted. So whatever time you are allotted, if the audience knows that you're going to be there for 10 minutes, 15 minutes, half an hour, 1 hour, till 1 hour, like whatever their time, allotted time, they are mentally okay with that. Anytime if you go beyond that, they will start losing attention and their interest. So we have to learn to make sure that whatever content we have to fit into that much of time. In case if you think you are going beyond 5 or 10 minutes here and there, it's probably acceptable to audience also. But going beyond that, you will not be able to retain their attention. So it's better to cut down your content to fit in that much of time. So allotted time, and that also comes with a lot of practice. I'm sure many of you may be presenting in conferences where you are given just 8 minutes or 10 minutes to talk. And if you go beyond a point, then even your presentation is actually taken away from the screen. So it's all the more important that we practice in a manner that we know how much of exact time are we really going to take when it comes to delivery. And I've seen a lot of mishap happening in the conferences where people are not even able to complete their introductions, and they go on and on and on, and they don't realize that they have not been able to deliver the actual content they had to deliver. So when you are planning a program, it's very important to make a list of the resources required, because a lot of time a simple thing not being there or not working can actually completely derail your program. Things like what is the sitting arrangement. It's always good to know what is the sitting arrangement. Preferably you should have tables, and around table you can have 4 to 5 people, so it becomes easy to handle tables than having people sitting like in an auditorium. Projector, make sure that it is working, it is functioning, the projection is clear, and the lighting in the room is okay. Mic is working. A lot of time the mic is not in that good condition. Audio system for video projection you need to check beforehand, because a lot of time you have wonderful video but the audio system is not working and your videos go waste, or they are not really that impactful. Having a wall clock facing you is a good idea. That gives you a good control over time and content, because you will have a lot of content at hand. But keeping an eye on the wall clock will give you a chance to regulate your content as per your requirement. So make sure that you have a wall clock facing you and not your audience. Name tags is a good idea. Especially like, for example, with students, when you are taking a session, just a small 2 by 3 inch thick paper, and ask them to write their just first name in capital. Having a name tag and being able to call them by name can definitely get their attention. So here also, if you see, now of course now I know everybody's name, but then initially also I tried calling all of you by first name, so that you know that I know you and you know me, and we are connected with each other, and that gives you a lot of control in the program. Whatever stationery you think you will require during the program, make sure those things are arranged. Things like, if you are planning to do some activities, those props should be ready and working. Facilities like water, tea, coffee, toilets, restrooms, I think these things are basic, but make sure that they are in place. I went for a oration to one of the medical colleges last month, and I happened to be to their toilet, and it was just horrible being there. So we normally look after the front area and sitting area, but we sometimes miss to look after the back end area that may be really really important. So make sure that these things are working in place and in good condition. So when you have these things in place, you feel more in control and in order. That's the whole idea of talking about these resources. I'm sure with time you will actually have all these things on mind, but keeping a list on your mind will give you clarity on making sure that these things are not missed. So quickly, just a couple of slides and then we complete it. It's about how do you really, run a successful program? As I said earlier also, make sure that you are able to bring in what is in it for me, for your audience. Nobody will listen to you unless they find how are they going to be benefited. So make sure right in the beginning you integrate what is in it for me, and that will get their attention, that will get their engagement. Second thing is, beginning and end are very important. Make sure that your beginning is really done well. So there's a saying, well begun is half done, and that's actually true. If you're able to capture your audience attention, it's easy to keep them engaged. And then also when you're moving towards end, make sure that your carry home message is very, very clear to your audience, and they really go with some takeaway and find it useful for them. Another important thing that I want to bring in here is ask thought-provoking questions. So Socratic questioning is something that I would recommend to all of you. Whatever answers you have on your mind or whatever message you want to give, convert them into questions, and you will get a lot of beautiful answers from your audience. And that will also keep them engaged, because everybody likes to speak. So if you allow them to speak, it will put less stress on you and also give them a chance to share their experience. Experience has long-lasting impact and content has limited value. So try creating as many experiences as possible. Every time I ask my participants, what do you, till now we have not started doing role plays. We will be doing it from session 5 onwards. But when we start doing role plays and case studies, I constantly receive this feedback from my audience that role plays and case studies are the best learning points, because they are completely 100% fully engaged in that. And that's what really carries value, and they remember it for very, very long. So when you are actually using all ways of learning, so you can see through this fMRI that you are using more areas of your brain and you tend to get engaged. So only reading, only listening, and only recalling is just one part of the brain. Whereas when you are actually engaged totally, you are more likely to use different parts of the brain. And that's the whole idea about, creating, training, interesting pedagogies. Whatever you say, make sure that you support your opinion or your statement with studies and reports, especially with educated audience. If your point of view is validated with studies and report, they are likely to trust you and easily align with you. Keep yourself updated. Make sure that you read a lot of books. You have enough, information, knowledge about what is happening across the world. What are the different protocols available? What are good books that can help us grow in our life? And that actually also shows that you are well read and you know your subject very well. So just going and repeating the same thing will not help, but you really need to keep updating yourself. As I said earlier also, regularly time your sessions, be realistic in how much you can cover in time. A lot of time you create a lot of content, you're not able to deliver in time, you go beyond the time and your audience is just fed up with you. The whole impact of your program can go haywire if you don't deliver it in the stipulated time. So I have brought this here because I have experienced it personally, and I have learned from it that whatever time you have decided, stick to that timeline. Read the feedback very carefully. Whatever feedback you give, I always read everybody's individual feedback. Similarly, make it a habit to read your audience feedback. You will get a lot of interesting feedback and input from them that you can use to improve your program and your sessions. Regularly reflect on your performance, see what you need to change. It could be content, it could be delivery, it could be your body language, it could be your hand movement, it could be the way you stand, it could be anything. But if you will, sit and reflect, you will get a lot of, ideas what you need to improve on. So to quickly summarize what we have discussed in today's session about designing a program, I think first of all, we need to have clear objectives. Be very clear what you want to really attain to the program, who is your target audience, so that you can tailor the program according to their needs. The content has to be relevant, up to date, and aligned with their need and also the objectives. Engage them, make sure that you use varied instructional methods all through your program, make it interesting, enjoyable, curiosity, and also, experience sharing, which they really, really enjoy. So organize your, content in a very logical manner, so that from simple to complex, from easy to difficult, from known to unknown. We'll be discussing about this in the next session when we talk about delivering us a topic. We'll talk about this, but make sure that your content is organized in a structured manner. And then, of course, the instructor or the trainer or the faculty has to be, very knowledgeable and skilled. Only then you will be able to win confidence of your audience. And then regular assessment and feedback will help you improve your performance throughout. Flexibility, being adaptable to different learners, different situations, time, what is not available, what is available. That's going to really help you be confident and also connected with your audience. So make sure whatever you talk, it has practical application. So take real life scenarios and also, make people talk about their learning, so that your training remains relevant and also useful to them. And then, of course, continuous evaluation improvement will help you to refine your session. So I think one message that I want to give you, whenever you will make a beginning, it will be a beginning. And I read a beautiful message, I think I have posted also on my LinkedIn. It says that if you want your 100th performance to be the best, you will have to make beginning somewhere. And the first one will never be so good. So you will have to really practice, and that's going to make your performance better. Have you heard of this concept of 10,000 hours? Have you heard of this concept of 10,000 hours? Mariam says yes. Okay, Mariam, please explain for all of us. Mariam, you're not visible. Some challenge with your network? Okay, so I will do this. There's a theory that says that if you spend 10,000 hours into anything, you will be master of that particular subject. It could be anything. It could be, actually it started with piano practice, but now it says that if you want to be master of anything, spend 10,000 hours into it. You can do anything. So if you want to be communication trainers, start spending time into communication. Read, write, think, do lot of trainings. I did almost 500 trainings for 2 years for government hospitals, which covered doctors, nurses, paramedical staff, housekeeping staff, security staff, everybody. But that gave me so much of exposure and learning, and the kind of questions they ask, the kind of challenges they experience. How do you find out ways for them to, in the same situation, in the same constraints? That's the beauty of doing such programs. Wherever you are, start doing sessions for your staff. We have covered already 2 topics. Essential skills we have covered, developing communication competencies we have covered. Start doing 10 minutes, 15 minutes, 30 minutes sessions for your staff wherever you are. It could be doctors, nurses, paramedical staff, front desk staff. And then you become the master of it. I know it's 10:05. Any questions about whatever we have covered? Okay, so I ask question if you don't have question. Did it bring in some clarity in the structure of how to design a program? You get more clarity on it? some idea, because we do it. I'm not saying all of you must be doing it because you're all seasoned, people in your own area. But then if you have a structure, it becomes easy. You clearly know. Maybe you will not be doing training yourself. People working under you could be doing the training. But if you know the structure, you know that this step is important. This has to be done. This has to be followed. That's the whole idea about it. So I will not hold you further. I will share the feedback form in the group. One more request. Next week, I am going to Bangalore to one of the hospitals to do a master trainer program in a physical setup on site. So I will be away and I'll be returning on Thursday night. So next Thursday, we cannot have the session. It can be on a Friday, if that works for all of you. Are you okay if we do it on Friday? Anybody who has any problem with Friday? I'm sorry, such situations will happen whenever I'll be invited for a program outside.
Same time.
Yeah, same time, 8 to 10.
मैम
जी
मैम हमारे यहाँ श्रोफ हॉस्पिटल में 8, 9, 10 3 दिन कंटिन्यू क्लास है 2 बजे से लेके दोपहर 2 से शाम को 7 बजे तक। तो ये कंटिन्यूस क्लास थोड़ा लंबा हो जाएगा हमारे लिए।
सत्यपाल, फिर एक काम करेंगे, ये वाले सेशन की आप रिकॉर्डिंग सुन लेंगे अगर आप, नहीं तो फिर एक हफ्ता पूरा मिस हो जाएगा।
मैम वेडनेसडे पॉसिबल है क्या?
बेटा, आई एम गोइंग टू बैंगलोर ऑन मंडे।
ओके
मेरा वहां पे 3 दिन का प्रोग्राम है, क्योंकि ये जो 20 आवर्स आपके साथ करने हैं ना, वहां मुझे ये 2.5 दिन में करके आना है, बाकी उनके साथ जूम में करूंगी।
ओके ठीक है मैम।
We are having long classes, so
yeah,
long day for you.
I know, I understand. पर इसकी अपनी ब्यूटी ये है that you get 10 weeks time and we really gel well with each other, and there's lot of learning when we are interacting on weekly basis. But
we'll try.
हाँ जी
मैम कोशिश करेंगे क्लास कंटिन्यू करने की।
थैंक यू। मैं वैसे भी एक कहावत है,
able to focus better.
वैसे भी एक कहावत है, we don't grow from what we do between 9 to 5. We grow from what we do from 5 to 9. तो मेरा तो प्रिंसिपल ये है। और आप तो अभी यंग हो, बहुत बच्चे हो, मेरी एज में आने के बाद कहना कि सर मैं थक जाएंगे, मैं तो कभी नहीं कहती मैं थक गई हूँ। देयर इज नो वर्ड कॉल्ड थक गई हूँ in my dictionary. And I'm 62, please remember. ठीक है? So stay full of energy with me and let's meet next Friday. Thank you everyone. Good night. Thank you. Bye-bye.
Thank you, madam.
Thank you so much.
Thank you so much, ma'am. Thank you.
Thank you.
Good night, everyone. Thank you.
Thank you. God bless you all.
Good night, everyone. Thank you, ma'am.
Good night.